They're unsightly and embarrassing, but they can also be very painful. Varicose veins are knotted, enlarged veins that may be visible through the skin. Most often found in the legs or feet, varicose veins are a common nuisance for many, but for some, they can cause aching, swelling, and burning.
On a daily basis, my varicose veins caused my legs to get tired, but the primary problems that I had were the cramps, waking me up during the night with the leg cramps.
Varicose veins are caused by increased blood pressure in veins near the skin's surface. Vein valves allow blood to go back to the heart in one direction. As we age, these valves degenerate and can leak. This condition is called venous reflux or venous insufficiency. Sitting or standing for a long period of time causes the blood to pool, increasing pressure on the veins and sometimes stretching them out. The result? Thick, twisted cords known as varicose veins.
Every patient with varicose veins, by definition, has venous incompetency, which means there's too much pressure inside their leg veins and there's too much stagnation of blood flow. The risk for blood clots is quite a bit higher than the average normal population. They have a much higher incidence of leg swelling, of leg pain, a whole bunch of symptoms. Even in the end spectrum are these very painful ulcers that patients get on their ankles.
There are ways to help prevent or slow the development of varicose veins. Losing weight, exercise, and elevating your feet can help. But once they do develop, patients now have advanced effective treatment options that reduce recovery time. In years past, a painful procedure called vein stripping was the standard of care. Today's treatments are much less invasive.
We used to strip the veins out. That was the old treatment, very unpopular. The modern treatment is to do what we call endovenous laser ablation. So we close the veins with the laser. We don't strip the big veins out any longer. The stripping surgery really was attendant with quite a lot of pain. Patients missed work, several weeks' work usually. The endovenous laser ablation is associated with minimal pain. 4 out of 10 of our patients report they have virtually no pain. Their downtime is most of the time 2 days. The day of procedure, they behave themselves. 2 days later, they can go back to work.
Since I've had my vascular surgery, my life has gotten much better because I don't wake up during the night with leg cramps, and also I can do things that I enjoy, like gardening without any problems. I find that I can walk more, do more, and I just don't have any pain. They're like new legs.
The general public has always thought that any vein-related problem, especially varicose veins, are a cosmetic issue, not a medical issue. And that's completely wrong. Varicose veins are a sign of an underlying abnormal vein circulation problem. The public should understand they really should seek out the doctor who specializes in treating vein problems. If he does primarily vein problems, it's even better. There are those who do vascular surgery and vein treatment. I think they're perfectly qualified.
The Alabama and Atlanta Vascular Vein Center is on the cutting edge of vein treatment. With 5 locations in Alabama and Georgia, this is the preeminent phlebology center in the United States, delivering diagnosis, expertise, and state-of-the-art treatment options.
Our mission is to provide the very highest quality care for every patient suffering any type of leg vein abnormality. There's a broad spectrum of symptoms they suffer. We have to let the public and physicians, for that matter, know who are the patients who suffer, and we can provide the care to restore the quality of their life.
Led by renowned phlebologist Dr. John R. Kingsley, the Alabama and Atlanta Vascular and Vein Center offers the latest treatments for vein disorders, including endovenous laser ablation and microphlebectomy for the treatment of painful varicose veins, the VeinWave device for eliminating small visible veins in the face, arms, and nose, and sclerotherapy to treat unsightly spider veins.
We do cosmetic spider vein treatments, as do a lot of people. The first thing is a lot of people use lasers for spider veins, and the lasers, in my opinion, are not very successful. We tried them all and they didn't work very well. We use a very nice solution invented in Italy, and we add some components to it, and the results are just outstanding.
The Alabama and Atlanta Vascular Vein Center also offers cosmetic surgery procedures during leg treatments.
Offering combined procedures for patients gives them the opportunity to combine their recoveries. So they're going to have less time away from work or away from their families and doing the activities that they like to do. It also is much less expensive for patients when they're able to combine procedures. In addition to that, it's one anesthesia time, so it's less time that they have anesthesia.
Patients at Alabama and Atlanta Vascular and Vein Center are thrilled with their lasting results.
I had the laser ablation, which dissolved the problem veins, and after that occurred, then my circulation in my legs was great, and so I've had no problems, just lots of energy and good legs. I highly recommend Dr. Kingsley to anyone who is looking for any kind of vascular surgery. I think he is an expert in his field, and he just really cares about his patients and does a wonderful job with them.
If you have varicose veins, don't live with them another day. Contact the Alabama and Atlanta Vascular and Vein Center. Visit us online at alabamavascular.com.